Now it's time for today's In Depth. Medical advancements taking place every day. And a St. Petersburg College professor, Betsy is one of the first people to try some new technology that cures common sight disorders. It's called Vivid Vision. In today's In Depth, Dr. Randy Shuck sat down with Betsy and an eye doctor with Bright Eyes Family Vision to talk more about that new procedure.
Joining me now are special guests. We have an interesting topic today. It's about our vision and the things that we don't understand sometimes that we're missing. So there's a new thing out called Virtual Reality Vision Cure, and I have Dr. Nathan Bonilla-Warford, as well as our nice patient. I shouldn't say subject, but our patient anyway. We have Betsy Yaros. So thank you so much for joining us today.
Thank you.
Thanks. So we're going to talk about something that a lot of people kind of notice, but when you have it, you don't really notice. You had some visual challenges as a younger person. Tell us about what you were having problems with before, and then we'll talk about the therapies you're having now.
Okay. I was born prematurely with crossed eyes, so I had a surgery when I was first born, and then growing up, the surgery didn't correct my vision, and so I had to use assistive technology to help me read in school. And then as I progressed and got older, my vision actually got worse and worse, and I started not being able to do my schoolwork.
All right, so give us the diagnosis of what she had originally and then the latest one as well.
So she was born with esotropia, or crossed eyes. And then the surgery actually caused her to have exotropia, or a wandering eye, where her eyes didn't work together very well.
And so when they don't work together, we can't focus on one issue, and so lots of symptoms. Tell us about some of the symptoms you're having.
When I went to try to read a book, I would have massive migraines. I just had to stop reading. I also used to walk into poles. I used to open doors in my face. My parents wouldn't let me ever hammer a nail because I'd miss the nail.
You might hit your thumb. It's funny how you can hit your thumb, but not the nail.
Right.
Yeah. So you had problems with depth perception as well. So, and did you have problems tracking things? Obviously, reading. Obviously, you have to track across, but like maybe driving a car or walking down the street.
Yeah, I couldn't drive very safely because my eyes would flip back and forth so frequently. It just made it very hard to drive.
So you had 2 points of references, and so you couldn't really control which eye you were looking at all the time.
Right.
Okay. So we're going to talk about the new therapy that you have on. So tell us a little bit about the idea behind it and how it works.
So the idea is to use virtual reality to do what we do in vision therapy normally. What we do in vision therapy is we teach patients how to use both of their eyes together. So the brain takes the image that each eye gets and puts it together, and then helps us know where things are and how to interact with the world. We've been doing that in vision therapy for a very long time. Now we can do it even better with the computer-generated virtual reality specifically tailored for those kinds of techniques.
So you have some nice space goggles here. Tell us a little bit about these and how they work.
So this is called the Oculus Rift headset, and this is what the Vivid Vision software uses to deliver the virtual reality. And basically it just goes over the glasses like this, and then each eye gets a precise image. We can control those images very exactly, how bright they are, where they are. The way it works is both eyes get images together, but each eye gets slightly different images to stimulate the brain to use the eyes together.
All right, so you've been through this, obviously. Does it feel interesting, different? Does it give you any discomfort?
No, it's very easy, and it's actually a lot of fun to play. And the most exciting thing that happened, I only played the game for 5 minutes, and I took off the goggles and saw 3D for the first time in my life.
That was an amazing day, I would imagine.
It was incredible.
Yeah, I was reading some of your blog stuff where you were so mesmerized by a pile of dirt. So I guess you can get a little lost in reality a little bit too, but that's the things that we take for granted, which leads us kind of to the things that we have that people don't recognize that they have these problems sometimes. So you obviously were born with it, you kind of struggled with it. So obviously as an ophthalmologist or optometrist, we want to make sure that people are going in to get their eyes checked. So tell us a little bit about the youngest age we can do this to and what their typical symptoms are.
So many times children, they don't really recognize the problems they have as symptoms, which is why we recommend eye exams as early as 6 months of age, and then 3 years, and then every year during school. And a lot of times we catch if they have either amblyopia, which is called lazy eye, or wandering eyes, but sometimes they might not have anything that's actually apparent. You might not be able to look at them. And during the exam, we will determine if they have good depth perception, if their eyes move and focus well for reading and writing and the things that they need to do at school. If they don't have those skills, then we do different techniques to help them learn how to develop those skills. And Vivid Vision is part of a whole program to develop those visual skills and visual awareness and visual confidence.
So obviously, video game. Kids love video games.
Absolutely.
So it's not like you got to go and get a shot or something.
Right.
What's the youngest age that we can do this, and what's the successful time frame?
So the youngest patient that I have using this currently is 6 years old. It seems to work very well at patients that age. That's an age where they are more aware and more able to verbalize what they're experiencing, and doing so we can tailor the therapy very well. Younger than that, we recommend real space activities where they're on the floor and they're playing and we're interacting with them visually that way. What we're finding is the Vivid Vision technology as part of our vision therapy program definitely speeds up the rate of progress. So what maybe we would think of taking years to treat in the past is happening, much quicker. Maybe months in some cases. So it's an extremely exciting topic.
Obviously, it is, and for someone who has seen the difference, obviously, it's a very exciting thing. You, real quickly, tell us the name of the blog that you have that you write about this.
Oh, it's on my website, betsyyaros.com.
Excellent. And as a professor of teaching computer sciences, I imagine this makes your life just a little easier, being able to see the screen and not have blinding headaches when you're doing it.
Yes, definitely.
Yeah. So thank you so much for sharing your history, your story. Thank you for the new technology and the new games that we have. And hopefully everybody can take away a couple of things, that don't be afraid to look for help and make sure that we are looking to the right people for help. Make sure we screen our kids, because the symptoms are not always visible to the naked eye, I guess we could say. Thanks so much for joining us today.
Thank you for having us.